The heart is one of the most important organs in the body, if not the most important. So you'd think that America, being one of the leaders in the medical industry, would put a lot of effort and time into taking care of the heart. Yet unfortunately, one of the most serious yet preventable cardiovascular diseases is the most rampant in the United States. This disease, of course, is hypertension. Hypertension is a disease that's characterized by abnormally high blood pressure of either the systolic or diastolic value. This is the top and bottom number that you receive when you get your blood pressure taken. According to the Center of Disease Control, 67 million Americans have high blood pressure. This is more than 31%, otherwise 1 in 3 adults in the nation. So take a second and just think about the people around you and having 1 in 3 of your family members, your friends, your coworkers having this disease. Clearly, this is an epidemic within the United States that needs to be taken care of. Furthermore, the disease costs approximately $47.5 billion annually. This is due to medical services as well as medication. So clearly this is an issue that does affect not only the patients, but also those around them. So before we begin to discuss about what causes high blood pressure, the damage caused by it, and how to prevent it, it's good to understand what the whole disease is about. So blood pressure is a measurement of the force against the walls of your arteries as your heart pumps. Now, normal blood pressure is considered to be anything underneath 120 over 80 millimeters of mercury, while anything above 140 over 90 is considered hypertensive. Anything in between these values is considered prehypertensive, but overall, these values are very standard and is consistent throughout the world. Now, this high pressure that is pumping against the walls of your arteries actually causes the blood vessels to damage, which causes the vessels to stiffen and leads to a buildup of plaque on the walls, as we shall discuss later, for it causes a lot of other things in the future. There are many risk factors that can cause hypertension, and as such, if you avoid these risk factors, you can actually hopefully prevent you getting hypertension in the future. There's one type of hypertension that is called primary hypertension. Now, unfortunately, this hypertension, you actually cannot pinpoint a specific reason for it, and it's called essential hypertension. Other patients do have underlying conditions that exacerbate the symptoms that are caused by hypertension, and this is known as secondary hypertension. The various conditions that do have an effect in getting high blood pressure are things such as kidney problems, adrenal gland tumors, thyroid problems, drug abuse, and sleep apnea. So some factors that you can control and some factors that you can't. Unfortunately, genetic predispositions also have a huge factor on whether you get high blood pressure. As for the most part, if your family members do have high blood pressure, you have a high chance of getting it as well. But there are some preventable things that you could do that would cause high blood pressure. Things such as your diet. Salt has a huge effect in causing high blood pressure. So it's necessary to have a low salt intake diet. Obese people also have a huge chance of gaining high blood pressure, as this will be discussed in the future. So hypertension, as I stated, heavily damages the blood vessels throughout the body, resulting in actually a smaller blood vessel, and it gets to shrink, and eventually it might even cause a blockage. This can then cause further damage to the important organs in the body. As you can think, it would be really bad if blood couldn't get to, say, your brain or your lungs, etc., etc. And as such, it can also bring about a multitude of cardiovascular diseases, such as heart attack, heart failure, and stroke. One of the biggest reasons this occurs is actually for left ventricular hypertrophy. So think of the heart like a muscle. And like any other muscle, when you work it out really hard, the muscle gets bigger. Hypertension is kind of like putting weights on the barbell. And your heart's working out harder and harder and harder. And as such, your heart's getting bigger and bigger and bigger. Unfortunately, this is not what you want. Because what happens is the space inside of the heart gets smaller and has to work even harder to pump blood throughout the body. And as such, this can lead to many things, like I said, as heart failure, because the heart just ends up getting worked out way too much. Some other minor problems are headaches, vision problems, and chest pains. So whenever you have any of these symptoms, it might be a good idea to check whether you do have high blood pressure or not. In addition to all these problems, as stated before, high blood pressure can incur thousands of dollars of medical costs for patients, which can take a huge toll, especially for those in poverty. However, with all these things being said, and it may sound like hypertension is a very scary thing, it's actually very easily preventable if the right measures are taken. Blood pressure can be actively controlled using an antihypertensive medication, as well as a strict low-sodium diet and exercise. Obesity, once again, is a huge factor, and as such, if you decrease your BMI, you have a higher chance of taking away from your blood pressure and hopefully getting it back to a lower number. There are also many other multivitamin therapies that are being used currently that may help with high blood pressure, things such as vitamin D and vitamin C. Of course, like any other disease, it's really important to follow up with your physician because they know the best. There are many different types of medications, so it's never good to experiment. Just ask your physician, and there's a good regimen that they'll put you on in order to make sure that you can get your high blood pressure down. Avoiding stress is crucial. The stress response in the human body always increases blood pressure. As such, making sure you have good rest, making sure you have relaxing days, and not overworking yourself is important in making sure that high blood pressure does not take over your life. Limiting smoking, alcohol, and drug use is vital in order to make sure that blood pressure stays low. Overall, high blood pressure, or hypertension, should I say, is a very important disease that's taking over our nation. However, with the appropriate measures, we can take away this epidemic and make better impacts for the future.